Ototoxicity. Ototoxicity is the property of being toxic to the ear, ear, specifically the cochlea or the auditory nerve, and sometimes the vestibular system as well. And this can happen as a side effect of a drug. The effects of ototoxicity can be reversible and temporary, or it can be irreversible and permanent. It has been recognized since the 19th century. There are many well known ototoxic drugs used in clinical situations and they are prescribed despite the risk of hearing disorders for very serious health conditions. Ototoxic drugs include antibiotics such as gentamicin, streptomycin, tobramycin, loop diuretics such as furosemide, and platinum based chemotherapeutic agents such as cisplatin, carboplatin, and vincristine. A number of non steroidal anti inflammatory drugs have also been shown to be ototoxic. This can result in sensorineural hearing loss, disequilibrium, or both. Some environmental and occupational chemicals have also been shown to affect the auditory system and interact with noise. The cochlea is primarily a hearing structure situated in the inner ear. It is a snail shaped shell containing several nerve endings that makes hearing possible. Ototoxicity typically results when the inner ear is poisoned by medication that damages the cochlea, vestibule, semicircular canals, or the auditory or vestibulocochlear nerve. The damaged structure then produces the symptoms the patient presents with. Ototoxicity in the cochlea may cause hearing loss of the high frequency pitch ranges or complete deafness or losses at points in between. It may present with bilateral or symmetrical symptoms or asymmetrically, with one ear developing the condition after the other or not at all. The time frames for progress of the disease vary gently, and symptoms of hearing loss may be temporary or permanent. The semicircular canals are three bony structures filled with fluid. As with the vestibule, the primary purpose of these canals is to detect movement. Each canal is oriented at right angles to the others, enabling detection of movement in any plane. The posterior canal detects rolling motion or motion about the x axis. The anterior canal detects pitch or motion about the y axis, and the horizontal detects the yaw motion or motion about the z axis. So, therefore, when a medication is toxic in the vestibule or the semicircular canals, the patient senses loss of balance or orientation rather than losses in hearing. Symptoms in these organs present as vertigo, difficulty in walking in low light and darkness, disequilibrium, oscillopsia, among others. Each of these problems is related to balance, and the mind is confused with the direction of movement or lack of motion. Both the vestibule and semicircular canals transmit information to the brain about movement, and when these are affected, they are unable to function properly, resulting in miscommunication with the brain. When the vestibule or semicircular canals are affected by ototoxicity, the eye can also be affected, and this can result in nystagmus and oscillopsia. These are two conditions that overlap the vestibular and ocular systems. These symptoms cause the patient to have difficulties with seeing and processing images. The body subconsciously tries to compensate for the imbalanced signals being sent to the brain by trying to obtain visual cues to support the information it is receiving. And this results in that dizziness feeling patients use to describe conditions such as oscillopsia and vertigo. Cranial nerve 8 is the least affected component of the ear when ototoxicity arises. But if the nerve is affected, the damage is most often permanent. Symptoms present similar to those resulting from vestibular and cochlear damage, and these include tinnitus, ringing of the ears, difficulty walking, deafness, and balance and orientation issues. Let us have a look at the common ototoxic agents. Number one, antibiotics. Antibiotics in the aminoglycoside class, such as gentamicin and tobramycin, may produce cochlear toxicity through a poorly understood mechanism. This may result from antibiotics binding to NMDA receptors in the cochlea and damaging neurons through excitotoxicity. Aminoglycoside induced production of reactive oxygen species may also injure cells of the cochlea. Once daily dosing and co-administration of N-acetylcysteine is done, this may protect against antibiotic-glycoside-induced ototoxicity. Macrolide antibiotics, including erythromycin, are associated with reversible ototoxic effects. The underlying mechanism of ototoxicity may be impairment of ion transport in the stria vascularis. Predisposing factors include renal impairment, hepatic impairment, and recent organ transplantation. Next, loop diuretics. Certain types of diuretics are associated with varying levels of risk for ototoxicity. Loop and thiazide diuretics carry this side effect. The loop diuretic furosemide is associated with ototoxicity, particularly when doses exceed 240 mg per hour. The related compound ithacrenic acid has a higher association with ototoxicity and is therefore used only in patients with sulfur allergies. Diuretics are thought to alter the ion gradient within the stria vascularis. Bumetanide offers a decreased risk of ototoxicity compared to furosemide. Chemotherapeutic agents. Platinum containing chemotherapeutic agents, including cisplatin, carboplatin, are associated with cochlear ototoxicity, characterized by progressive high frequency hearing loss with or without tinnitus. Ototoxicity is less frequently seen with the related compound oxaliplatin. The severity of cisplatin induced ototoxicity is dependent upon the cumulative dose administered and the age of the patient, with young children being most susceptible. The exact mechanism of cisplatin ototoxicity is not known. Now, toxic skin preparations such as chlorhexidine and ethyl alcohol have the potential to be ototoxic. However, should they enter the inner ear through the round window membrane, and this is done or happens when we use it to sterilize during ear surgery. This potential was first noted after a small percentage of patients undergoing early myrinoplasty operations experienced severe sensorineural hearing loss. It was found that in all operations involving this complication, the preoperative sterilization was done with chlorhexidine. Treatment. No specific treatment may be available, but withdrawal of the ototoxic drug may be warranted when the consequences of doing so are less severe than those of ototoxicity. Co-administration of antioxidants may limit the ototoxic effect. Now, herein we have an overall comprehensive view about ototoxicity.